Is cancer now considered curable?
Cancer now is treatable if it is detected early. I am Dr. Gregorio Galve. I'm a medical oncologist, the head of the cancer chemotherapy unit of Doctor's Hospital. As an internist medical oncologist, we are the one who discuss to the patient the treatment protocol or the treatment plan for the cancer patients, and also we decide what we're going to do to the patient. For example, if the patient needs surgery, needs chemotherapy or radiotherapy.
Doc, can you expound what is cancer?
Cancer is a disease wherein our body cannot control the growth of the cells. So meaning the cells go uncontrollable, they divide rapidly such that they invade other parts of the body and they metastasize and then eventually kill the patient, kill our bodies. Cancer is a disease of many causes. It may be due to genetic itself, the genes that the patient carry. Number two, pollutants involved in the environment. The third is the food we eat and also the toxic products that is produced by the environment. We diagnose cancer mainly, number one is through history and PE, history and physical examination. Then we have the so-called the ancillary, just an X-ray, CT scans that would help us diagnose the patient. But the main diagnosis for cancer is that we do biopsy because we cannot treat cancer if we have no biopsy. So there are so many types of cancer. Number one is the adenocarcinoma, wherein it causes cancer cells in the epithelial parts of our body. Number two, the sarcomas. It involves the muscle and the bones. And we have also the lymphomas, where it involves the lymph nodes. We have also the so-called hematologic malignancies or the leukemias and the likes. Primarily, we treat cancer, number one is through surgery. If it is a lump or a mass, surgery should be done and should be biopsied. Then, after which we can do chemotherapy, wherein we use drugs to kill the cancer cells. And the third one is the radiation therapy, or the combination of those three treatments. Chemotherapy is the use of drugs to kill cancer cells. Actually, these drugs are being studied before and they are very effective in killing cancer cells. Nowadays, we have so many modalities, not only chemotherapies, but also we have the so-called the targeted therapy, wherein there is a receptor there, overstimulated by your cancer cells, then it would be targeted by the drugs. And also we have this so-called the immunotherapy. That's the latest treatment modalities in cancers. Chemotherapy, immunotherapy, and targeted therapy uses drugs for the treatment of cancer. Nowadays, chemo treatments evolve rapidly because nowadays we have the newer drugs, we have now immunotherapy and also targeted therapy, wherein we target the disease or the abnormal genes that could be effective to cancer later on. So that methods are now used in our setting, even in Doctor's Hospital. So our chemotherapy unit also evolved in time because nowadays we have the so-called the laminar, the biosafety cabinet that is recommended by the DOH to have that. So we have now the laminar flow to protect ourselves from being exposed to the drugs that we are preparing. And in Doctor's Hospital, we are not only doing chemotherapy but also administering the immunotherapy and the targeted therapy and also surgery. Actually, there's no one single factor that could prevent cancer, but explain to the patient that we should limit ourselves to eat healthy, exercise, and also minimize eating of the red meat, alcohol use, and a healthy living, a healthy lifestyle. Cancer now is treatable if it is detected early. So prompt diagnosis and treatment could make life longer and improve the survival of the patients. And also for the family, give support to your family members that has cancer because they need also spiritual and emotional support.